Today I will be talking about the importance of lifestyle measures in prevention and control of hypertension. Now, hypertension we all know is one of the very important risk factors for development of heart disease, and control of blood pressure goes a long way in controlling the complications related to it, particularly those related to heart. Now, there are lifestyle measures which are very important which patients with hypertension should adapt in order to control the blood pressure in an effective way. Now, lifestyle interventions have been shown in various studies that they not only help to lower the blood pressure, but they also increase the efficacy of the drugs which we use to control the blood pressure. They have also been shown to reduce the requirement of multiple drugs in the control of hypertension. So let's discuss about various lifestyle measures which we can advocate to our patients who have hypertension. Some of the important lifestyle measures which we should tell our patients are: one is weight reduction in those individuals who have weight gain or who are on the obese side. Number two is exercise. Number three is eating a healthy diet. Four is restricting the intake of the salt. Five is smoking cessations if they are smokers. Six is restricting the alcohol intake, and seven is to reduce the stress. So these are seven different lifestyle measures or modifications which you can say that help to control blood pressure and prevent it from worsening and leading to complications. So I will talk about each one of them in little detail. Now, the number one lifestyle modification which we tell to our patients is the weight reduction. So, individuals who have weight on the higher side, we call them as overweight or obese, and this is done based on a very simple parameter wherein we measure the height of an individual and subtract 100, which is called as the Broca's formula. So somebody who is around 164 centimeters in height would have an ideal body, should have an ideal body weight of minus 100, which is equal to around 64 kgs. So 10% above the ideal body weight we call as overweight, and 20% above the ideal body weight we call as obese. So individuals with obesity, we should propose them a good diet regimen which would help them in losing their weight. Another important parameter in those individuals who are obese, which is important to check, is their waist circumference, the measurement at the level of their waist. So in men, waist circumference above 40 inches, and in women, waist circumference above 35 inches is associated with higher risk for development of complications like hypertension, diabetes, and coronary artery disease. So these are some of the important parameters which we should assess in people who have hypertension to see whether they fall on the obese side, whether they are having a higher risk of developing hypertension or hypertension related complications. So once we know that these individuals are obese, we should propose to them a good diet regimen where we reduce at least 500 calories per day, so that they would have a weight loss of around 0.5 kgs in a week. So generally the weight loss which we should advocate to them should be gradual weight loss, which is considered as a healthy weight loss. It should be around 5 to 10% of weight loss over a period of 6 months. So this is something which we should keep in mind when we are seeing patients with hypertension. So weight reduction should be advised to those individuals with hypertension who are on the higher weight side or who are obese. The second important lifestyle modification which should be advised to them is exercise. So exercise is a very important lifestyle measure. Exercise has various advantages. Exercise helps to control the weight, it helps to prevent the weight gain, and it helps to lose weight in those who are obese. Exercise also reduces the triglyceride levels. It helps to improve the good cholesterol, which we call as HDL cholesterol. Exercise also helps to reduce the blood pressure. Exercise helps to release certain hormones called endorphins, which produce a complete sense of well-being. So exercise regimen should be advised to those individuals who have hypertension, and generally aerobic exercises are advised to the patients, and this can be in the form of simple walking, running, swimming, jogging, or even sports like badminton or tennis. So at least 30 to 45 minutes of exercise for 5 days in a week should be good. Resistance training or strengthening exercises like using weights or dumbbells can also be advised, but generally should be not more than 2 days in a week. So exercise definitely plays an important role in reducing blood pressure and controlling the blood pressure. The third important lifestyle measure which we would advise to the patient is eating a healthy diet. When I say eating a healthy diet, a diet which contains more of whole grains, diet which contains a lot of fresh fruits and leafy vegetables. This is very good in controlling the blood pressure. Increasing the potassium in your diet, which can come through either the leafy vegetables or the fruits, also helps to neutralize the negative effects of the sodium which is present in the diet. And also tell your patients to consume less of saturated fat. It could be low dairy fat, which we should tell our patients. Use milk which is skimmed or toned milk, and avoid red meat, and consume more of lean meat, or what we call as white meat, either a skinless chicken or fish, or egg white. So this kind of diet regimen which we advise to the patients to control the blood pressure is called as DASH diet, or otherwise called as dietary approach to stop hypertension. It has shown very clearly that also helps in reducing the blood pressure. The fourth important measure that we should advise the patient is restricting the salt intake. Low salt intake, even in modest amount, can help to reduce the blood pressure to 4 to 8 or 10 millimeters of Hg. Now, in our normal diet, we should advise, as per the guidelines, the sodium intake of not more than 2300 milligrams for patients who are hypertensive. In people who are more salt sensitive, you should advise them to take sodium intake of less than 1300 milligrams per day. So how should a patient look into the salt content in their food? So he should actually start looking at the food labels. That is very important, because then only you will know actually what is the salt content in your food. Particularly the processed food contains a lot of salt. Even the pickles which we commonly use in South India contain a lot of salt, which is used as a preservative and which is going to add on to the salt load in your diet. Now, if you really want to have a flavor to your food, instead of using the added salt which we commonly put on the table and use it, you can use a lot of herbs and spices which tend to substitute the salt in your diet. Even a single teaspoon of salt which is added contains close to around 2300 milligrams of salt. So definitely people who have hypertension should avoid extra added salt on their table. So this is again one very important lifestyle measure which we can advise to the patients. The other one is the alcohol restriction. Now, alcohol is something like a dual-edged thing. Alcohol taken in small amounts can help to reduce the blood pressure and also tends to increase the HDL cholesterol. But then alcohol taken in excess amount can actually lead to increase in blood pressure, which has been shown in many of the studies. Not only alcohol has an impact on hypertension, but also has on various other parts of the body, particularly on the liver. We all know that alcohol intake over a period of time can induce liver changes, liver damage in the form of fatty changes, or even hepatitis in the long run, leading to cirrhosis. So alcohol intake should be restricted in patients who have hypertension, and we should tell our patients, particularly men, not to take more than 2 drinks in a day, and in women not more than 1 drink per day. Coming on to the next lifestyle measure, which is smoking cessation. Now, smoking by itself does not increase the blood pressure, but acts as an additional risk factor for development of heart disease. So somebody is a hypertensive and he also smokes, then his risk of heart disease is very much increased. So in order to reduce this cumulative risk of heart disease in hypertensive patients, we should advise smoking cessations if they smoke. It is very important that we tell them what are the ill effects of smoking, what the smoking can do to you, not only in terms of worsening of your blood pressure, but also the impact on other parts of the body, like on the tongue or in the oral mucosa. It can cause oral cancer, it can cause carcinoma of the tongue, it can cause bronchitis, it can cause lung cancer, cancer of the pancreas, and the prostate. So there are multiple ill effects of smoking. So we should clearly explain to the patient and his family members what smoking can do to you in the long run, and how smoking cessation will be beneficial to you. And smoking cessation strategies should be explained to them. We have both nicotine replacement therapies and as well as non-nicotine replacement therapies, which the patient can take with the help of the family support and with the help of the doctor's support. He can successfully quit smoking. So smoking cessation is again very important in those individuals who smoke with hypertension. The last but not the least is reducing the stress. The stress is a very important integral part of our life nowadays. So Chronic stress can definitely contribute to development of hypertension, but acute stress can also lead to worsening of the hypertension, particularly if we respond to it in a different way. If we fall back on eating unhealthy food, if we smoke, or if you consume alcohol in order to reduce the stress, then it is going to worsen your blood pressure. So it's very important we identify what are the factors that are triggering stress in our life, and then deal with them in a proper way. So see that you organize your work properly, and then you coordinate your work. If you have problems at your workplace, talk to your boss. If you have problems at your home, talk to your family members, and set goals which can be accomplished in a meaningful way. Do not set goals which are very difficult to accomplish, and be okay with whatever you achieve, instead of feeling depressed about what you cannot do about certain things. And there are other measures which help to release or reduce the stress, like you can go on for a small vacation, you can take a weekend off, you can talk with your friends, you can go to yoga, you can take part in meditation process, or you can go with simple aroma or massage therapy. So these are all various measures which can help to reduce stress, and it's simple easy thing that you can do in your day-to-day life is 10 to 15 minutes of deep relaxed quiet breathing. This deep relaxed breathing also helps a long way in reducing the stress in your everyday life. So stress reduction is again a very important part of blood pressure management. So these are the 7 different lifestyle measures or modifications or the changes which you can adapt in order to control your blood pressure and prevent blood pressure from leading on to various complications in your life. Thank you.